It's Christmas.
Oh, I get it excited.
And we're back inside the ambulance.
Should we do it?
Should we do it?
Yes, that's what we're here for.
Do you know where you are now? You are.
For the very first time, we're with the West Midlands Ambulance Service from December
Christmas isn't cancelled after all.
to January.
Happy New Year, guys.
We filmed around the clock,
You're right, buddy.
It's starting to make you feel a bit funny. There you go.
capturing every moment of the festive season.
How does an elf? Never been flagged down by an elf before.
We've got a big telephone in the ambulance so we can talk direct to Santa.
Oh, we got to get you better for Christmas, haven't we?
Our paramedics reveal what it's like to deal with up to 4,000 emergency calls daily.
You got a nice cut there, haven't you, my friend?
1, 2, 3.
Don't get yourself worried, OK?
Rigged with cameras from all angles,
Fist bump.
we capture the action behind closed doors
He's got what looks like a single stab wound.
at one of the busiest
I think you're a very lucky man, Bernard.
and most challenging times of year.
His nose is a bit red. He looks a bit like Rudolph.
You've been absolutely amazing. I'm so grateful.
Merry Christmas, every one of us.
If Santa could bring you a present, what would you like?
I think I'm at such a sad age that I just think about the kids at the moment. I don't really care about my own presents.
Oh, you're going to make me look selfish now. I'm into photography anyway. I have seen a very sexy camera.
Ask me what I brought the wife.
What?
I brought her under-the-counter fridge. I just can't wait till Christmas Day when she opens that little door and see her face light up.
You didn't actually buy her an under-counter fridge,
No,
did you?
I didn't. It was my attempt to try and be funny.
To be a joke.
Yeah. It's not the same though when you have to explain it.
It's a brisk December afternoon on the outskirts of Wolverhampton.
New assignment.
Paramedics Dina Evans and Mike Hipgrave have just been informed about an elderly patient who's had an accident in the city centre.
We've got an 80...
Category 2.
Let me finish.
Okay,
An
I'm sorry.
89-year-old lady has fallen over. She's got a facial injury.
Dina used to be a hairdresser. She only recently qualified as a paramedic.
She's lying face down outside facial injury, chest pain and shoulder pain.
Regular crewmate Mike, however, has more than 12 years' experience.
You'd have wished you kept your coat on now. Right, which one was it? Halifax and what?
Well, that's HSBC.
There we go.
There we go.
There we are.
89-year-old Dorothy was out for a Christmas coffee with friends when she slipped and fell.
Hey, Dorothy. Hello. What's happened?
I don't know.
Unable to get up again, she's been lying on the cold pavement.
Dorothy, can you remember everything that's happened?
No.
No? You can't remember falling, sweetheart?
No.
OK. I know your nose is bleeding, but where else is the pain?
Oh, dear.
Where else is the pain, sweetheart?
My left arm.
Your left arm?
Yeah.
Have you got some in your chest as well?
No.
No, just that left arm. Tell me, is your hips are hurting, OK?
Nothing.
Nothing there?
No.
Just that arm. Dorothy, we're going to get you up, OK? We're going to put you onto a board, all right? Don't move. We're going to move you, OK?
Let me move this arm for you. I need to put it down by your side. OK. Roll it down by your side, sweetie. That's it. Keep it nicely tucked there for me. OK, then, on 3.
1, 2, 3.
OK, well done, well done. Just relax.
Okay.
Yeah.
1, 2, 3. Couple of bumps, Dorothy.
With Dorothy safely inside the ambulance, Dina needs to take a closer look to assess how severe her injuries are.
Dorothy, I need to cut your coat, your sleeve. We need to have a little look at that arm, don't we? How are you feeling now?
Oh,
They just come out
Okay.
of some pieces.
So you know where you've been. Do you know where you are now?
Yeah,
You are.
It's like a hairdresser.
yes.
That's the wrong one.
I know.
That was
But your gloves are soaking wet, Dorothy. All right.
Oh! I'm sorry to be a
You're not a
You're not a
nuisance,
nuisance, don't be
not at
sorry.
all.
Oh, I can't believe it.
Is it the wrist, is it?
I'm sorry, Dorothy. I just want to take your watch off, all
Take your
right?
watch off, yeah.
Because your wrist's swelling up a little
Is
bit.
it?
Oh, I think it's your wrist. No pain in your neck?
No.
Can I have a little feel of your neck? Because you bumped your head, didn't you? Is it hurting where I'm pressing?
No.
Lovely. All right.
Mike uses a vacuum splint to protect Dorothy's wrist during the ride to hospital,
Dorothy, I'm going to pop a little needle into your arm, OK?
before Dina gives her some much-needed pain relief.
Well, you
Sharp scratch, Dorothy.
A little bit of a trouble,
Oh, that's probably nice surprise.
You got a little tiny cut on you above your eye.
I thought I had.
I'm just going to give it a clean for you. You're very brave.
Just feels stupid.
Why?
It was an accident, Dorothy. They happen, unfortunately, especially in these kind of conditions.
What's the matter, Dorothy?
My neck hurts.
Your neck's just started hurting now?
Yeah.
We'll have to put a collar on, haven't we?
Yes.
Has that just started?
Yeah.
Since you've been lay flat?
Yeah.
We checked her from head to toe, hadn't we, and checked her neck, and there was no pain. The only pain that she got initially was her wrist. And it was only as we were about to leave that she started complaining that her neck was hurting, despite giving her pain relief. Yeah, we were concerned that Dorothy had sustained further injuries, so we applied the neck brace to get ready to travel to hospital.
I am sorry, chick. It's not
Oh, dear.
comfortable.
Yeah.
Do you want some stronger pain relief? Take that pain down.
All right.
Yeah?
Yeah.
Mike prepares a dose of morphine, the strongest drug they carry.
Make you feel a bit funny now, Dorothy. We can go.
I do feel a bit sick.
Feel like you're going to be sick?
Okay.
Mick, you might need to stop a sec.
If Dorothy vomits while wearing a neck collar, there's a danger she could choke. Dina needs Mike's help to turn her on her side.
She's going to be sick. All right, Dorothy? Feel okay?
All right.
Yeah.
Oh,
Don't worry, I'm here.
I'll get you there.
Yeah. All right, Dorothy, you all right to move again? You sure?
Mike turns on the blues and twos to get them to A&E without delay.
You've got lovely warm hands, Dorothy. You all right? What's the matter? Talk to me, Dorothy. I'm still here, don't worry. You're going to be sick? Yeah. Mick, you need to stop.
Stop.
Ambulance crew Dina and Mike are heading to hospital with an elderly patient who's fallen while out.
Mick, you need to stop.
Stop.
Dorothy has started to feel sick, but as she's immobilised with potential spinal injuries, there's a risk of choking.
You all right, Dorothy? Thanks. So I'll just hold the top. I'll stay here.
Do you want to let them know? Because the airway compromised?
Yeah, can we, please?
With Dorothy's condition deteriorating, Dina calls ahead to put the hospital on standby.
Hello, New Cross. I've got an alert for you. I've got a female has fallen with a left wrist injury. She's had IV paracetamol and she's had 2.5 milligrams of morphine. She is collared and boarded, but since then, we've got some vomiting en route, so we're just a bit concerned about airway compromise. We're about 5 minutes.
Anxious to get Dorothy to A&E, they can't stop again, so Dina has to manage on her own.
We're nearly there, Dorothy, all right? OK.
I'll do the pulling, just
take the weight from the bottom, OK?
Dorothy will be taken straight into A&E, where her sickness can be managed and the extent of her injuries assessed.
If it's too early for you for a mince pie, that's ridiculous. Too early to have a mince pie? Mince pies should be all year round. No. I'm very particular about my mince pies, to be fair. I only like my mum's. And my gran's, yeah, well, I did used to like my gran's. Obviously, she doesn't make them anymore, bearing in mind she's 6 feet under. Oh, dear. She's making them up there, mate, for you. Waiting for you to turn up. Should be waiting a while.
It's a wintry December afternoon. Dad of 5, Gaz Clark, and ambulance crewmate Lee Timbrell are 4 hours into their shift, and their next emergency has just come in.
We're going to 1 month old who's got blue around the lips.
Right, can I have a bit of a map, please?
4 minutes.
Blue lips could be a sign that the baby's struggling to breathe and not getting enough oxygen.
Oh, hello, sir. Cheers.
Inside, worried mum Anna, along with family and friends, is waiting with baby Freddie, who's just 8 days old.
Hiya, I'm Gary and Lee's just coming in. Is this the little one we've been called for?
Yeah.
Just hold them upright. Yeah. Any breathing difficulties, we always need to be upright. Let's have a look. How are you? So what's the concern then?
Apparently he's blue around the mouth.
So we'll check him all out first, make sure everything's okay. Yeah? We'll put our little SATS probe on and look at the oxygen levels and everything. Was it a normal birth? Was it a normal birth? Yeah, full term?
2 weeks early.
Right. Come on, can I have a little listen?
Baby Freddie was a lovely Christmas present who arrived earlier than expected. But he's been diagnosed with a heart murmur, And concerned by his colour, his parents are anxious to know everything's okay.
Rattling along like a little steam train. Absolutely lovely. Yes. Yeah. Oh.
It's responding to touch and movement.
Oh, God, how small are they? Oh, I'm sorry, I can't believe it. It's only been 8 months since my grandson was this size. How heavy is he?
£9.30. £6.13.
Six, I'm going to say.
Still tiny then.
Yeah.
All the baby's vital signs are good. But after getting a proper look at him, Gaz and Lee still have a concern.
You are jaundiced, ain't you? He seems tired. We are going to do a test that's going to upset him, which is a heel prick test.
Oh, no, not another
Yeah, with a spot of blood. Well, you called us. Yeah. Yeah. Oh, beautiful.
His nose and his lips were nice and pink, so there's no action for us to take there. He actually appeared quite yellow in the skin, which is called jaundice. If a baby becomes too jaundiced, then it is going to be very lethargic and not feeding properly. This is going to cause further problems and would need intervention. Being a father with 5 daughters and 1 grandson, I can understand why Anna has actually become quite worried about her child. It can be very, very scary.
Now, I think little 'un might wake up for me. Right, sorry, mate. I was going to... Yeah. That's better.
See, normal reaction.
Yeah. Oh, I hate doing that.
Mild jaundice in babies is common and can sort itself out if their blood sugars aren't too low.
Right. 3.1. So for a little child, no problem at all.
The blood sugars show Gaz that even for such a young baby, the jaundice isn't worrying. Baby Freddie seems to be doing well.
So, everything is normal. Got no concerns at all. Oh, it's lovely. Yeah, wrap him back up now if you want to.
Yeah, he's a bit cold.
Yeah, and my hands aren't exactly the warmest things in the world. Right then, Mum, we're quite happy. Everything's absolutely fine.
Any more concerns later on, you can still call us back.
Ah, it's lovely. Yeah, come on then, we'll get out of the way.
Thank you.
No worries at all.
All right then, go.
All right.
Take care.
Ta-da.
Ta-ra.
Even though he had jaundice, he looked gorgeous. I absolutely hate how to do the heel prick.
Yeah.
And it's like, oh, I need to, but oh, I don't like doing it with little kids. I think it hurts enough when we have it done to us and we're big adults and it's done on our fingers, which are rough, tough things. But doing our little baby's put, oh.
But parents on that one, they've done the exact right thing again. They had some concerns. Baby's only 8 days old, got a heart murmur. They rang 111 for some advice.
Yeah. Much rather go to kids when it's not needed than leave it too late when it's needed.
Yeah. Because babies and small children, they will go big sick very quickly.
Yeah, downhill fast.
Is this your first ever Christmas working?
Yeah.
You lucky, lucky thing. I think I've worked for the past 7 Christmases.
I've always found like the shifts over Christmas, I've always feel much harder and longer because of all the other stuff you do outside of work.
Yeah, you don't get the downtime because you've got all the family things to do in the meantime.
Yeah.
I did a Christmas in Iraq one Christmas.
Yeah.
Yeah, that was a good Christmas, that was. I remember Christmas Day, I was in a Sanger, machine gun in front of me, with my mate Badders. Went to midnight, we shook hands, put Christmas hats on. Cheers.
In the run-up to Christmas, roads can get especially busy. Ambulance crew Darren Westwood and Ash Bolus are navigating the seasonal traffic.
Now you've got a gap there. Go on.
Hello, that's the one. Thank you very much. We are big, yellow, and we've got big flashing blue lights.
So is Big Bird.
Yeah, that is true.
They're on their way to Sandwell, where a young woman has had a seizure outside the council offices.
29-year-old female that's fitting.
Needed assignment.
Fit approximately 1 minute, so it's lasted 1 minute.
Just watch that post there.
Yeah, miles away.
Don't like the concept of...
That's nicely done.
Mum of 3 Leanne is being looked after by fiancé Asif and another paramedic, Susie Drinkwater, who was the first at the scene after a passerby dialed 999.
Hello, I'm Ash, this is Wes.
She's been fine since I've been here.
Yeah.
She's had 3.
3 little ones. Lasted around about under a minute.
Under a minute?
30 seconds.
Okay. And she's known epileptic?
Yes.
All right. Are you up to date with all your medications? You haven't taken them this morning?
Seizures below 5 minutes, even though they can be scary, aren't that dangerous, but she was having cluster seizures, which could be dangerous.
Leanne made us aware that she hadn't taken a medication that morning. I was worried that she could have another seizure at any time. Right, hang on, let me just jump up there so I can just undo this. Come on up. Sit down there. Try and lift your jacket up so I can, because we're going to need to pop an arm out in a minute. If you, so she's had 3 today. What time did they start?
5 to 12.
5 to 12 they started. Okay. How are you feeling now? Cold. We have got the heater on.
You grab the top end, I want to do the bottom, whatever.
I'll grab the top end.
Whatever's happening here, look.
In the past, Leanne's had as many as 25 seizures in one day.
How long have you been fitting for? When did they first start in your life? When you was a kid, or?
I had them when I was a kid and it stopped and then it came back again.
How do you feel?
Cold, tired, my head hurts.
Is that how you normally go after a seizure? Yeah? Do you have any more seizures after that?
I can, yeah.
Obviously, it's important to take your medication because obviously that is what your body relies on to help minimise the risk of having a fit. Because if you were to have a fit and your partner wasn't there or you wasn't there in time and you fell over and sustained a head injury or something like that, obviously there's further complications, isn't there, to that? So it's really, really important that you take your medications. Any other health problems? So you say you've got sciatica.
Low blood pressure and I've had 3 surgeries as well.
What surgeries have you had?
Gastric bypass, cervical cancer and gallbladder removal.
You've been through the mill then, haven't you?
Yeah.
You all right?
Thank you.
You all right? Do you know where you are? Where are you? You're in an ambulance. Do you know what area you're in? Leanne had a long, complex medical history. However, we were more focused on the seizures, and I was worried because she appeared dazed and at risk of having another seizure. How does she look to you? Colour? Normal colour? Bit pale? You all right?
You dizzy?
I think my advice would be to go to hospital because I don't think you're quite with it as such at the moment. And I think there's potential that you're going to have more seizures before you get home. And I think the reason why you're having seizures is potentially because you've not taken your medication this morning. She's smiling, that's a good thing.
She knows what I'm like. I always make her smile.
That's good. It's good to have somebody like that then, isn't it? Yeah? So you're happy with that? Okie dokie, Wes, thank you. You all right?
Keep your eyes open, Leanne.
Keep your eyes open. Talk about something random.
Ash wants to keep Leanne awake and alert until she can get her meds.
Have you got everything ready for Christmas?
No.
No? You've still got shopping to do?
Hell of a lot.
So when did this all start with your health then?
I was all right and then that's when they caught the cervical cancer.
Yeah.
And then that's when I started having seizures.
seizures and things like that.
But keeping her conscious is an uphill struggle.
You all right?
Yeah.
You all right?
Yeah, you okay?
Just tired?
With Leanne slipping in and out of consciousness, the crew get her to hospital in the nick of time. She can now get the medication she needs to prevent another seizure.
Hold on tight, sweetheart. We'll just take you in on the stretcher. Right then, here we go. That was different. Out in a public place. She had
epilepsy,
a gastric bypass,
sciatica.
Sciatica. For a 29-year-old to have sciatica is quite unusual. She's had cervical cancer. So she has got a lot going on for a 29-year-old. Oh, man.
Good shot, bird.
Oh, that bird has just done the biggest dump on the truck.
It's the biggest sign of appreciation that we've had today.
Oh. I mean, oh, that is just wrong. I mean, that is a proper splat.
I bought a little elf hat, like a green elf hat, because I always tell the kids that I'm one of Santa's elves because they seem to like it when you say that. So I thought, if I wear a little green hat with this green uniform, I will look like an elf. It's got pointy ears on it.
No. Can you see my excitement on my face over Christmas?
Well.
I love Christmas lights. My house, when I'm older, flipping it.
When
I've got my own house, my house will be that house. That house. With all its Christmas lights on. I may even make it look tacky the first year, just because I can.
Oh, they've done well with their Christmas light. I think we've got the best Christmas lights.
Oh, I was just going to say they can't beat ours.
Can't beat our Christmas lights.
West Midlands ambulance crew Chris Irvine and Aaron Campbell are midway through their 12-hour shift. It's 1 a.m. on a busy Friday night.
I hate this junction.
Ah, it's terrible, huh? 2-3.
Their next emergency has just come through.
999 mode activated.
It's a Category 1, which is only used for patients in a life-threatening condition.
Oh, go left there, pal. 23-year-old, bleeding wound, heavily bleeding. Attacker's no longer nearby. Stab in the abdo. Oh. Patient is still awake, but looks very faint.
The stabbing happened in Sutton Coalfield, around 7 miles north of Birmingham, and there are multiple crews en route.
Right, nothing to the left, buddy.
Ah, it's down here, look.
Down here? Alright, there's another truck on scene. He does look a bit unconscious, alright?
Arrived en route.
23-year-old Callum is on the pavement, just meters from where he was attacked almost half an hour ago. The first paramedic on scene, Heather Gordon, is keeping him conscious. But his injuries look serious. He's lost a lot of blood.
We think we've been stabbed. It's one puncture wound at the minute. It's about 2 to 3 centimetres. However, it does look that there is something protruding, potentially maybe bowel.
ambulance crewmates Aaron and Chris are with a 23-year-old man who's been stabbed.
You all right, buddy?
It does look that there is something protruding, potentially maybe bowel. Okay.
You're all right, you're all right. Right up here, right up top, that's it. Well done, buddy.
Well done.
Well done, buddy.
The first crew at the scene are taking Callum, who's about to become a dad for the first time, onto their ambulance. The two teams need to work together fast. Callum could be bleeding internally.
One puncture wound, dude. Let's get this top cut off for me.
Yeah, I've got scissors.
I'll get some obs on.
Yes.
Yeah, Hannah. I'll get your jacket off, young man.
Can I have this off you, mate?
Can you cut this as well?
Yes. What's your finger?
I'm just going to do some obs on you. Do you feel sick or anything like that? What's going on? What's happened tonight? Have you been in a fight at all?
I was trying to calm it down.
Okay, good man. Let's get some O2 oil booster in, if we can. Do you want trauma? Yes, please. Right, and let's just
Pop
have a
this
quick
arm down
look
here,
at
Kill.
this.
What's that, mate? Okay,
Okay,
guys.
so we have some. Looks like bowel protruding.
Jobs like this one, you're just thinking, how serious is it going to be? He had quite a severe stab wound to his upper left abdomen, and that part of his bowel might have been protruding. And that's a massive infection risk, so it was time critical. We needed to act quickly.
Do you know what you were stabbed with?
I don't know.
Okay, did you see it at all?
No.
Did you realise you were stabbed straight away or not? Sorry.
I don't think it was.
Okay, that's fine.
You saw it anywhere
The
else,
ambulance teams have been joined by trauma doctor Matthew Boylan, a critical care specialist.
So Callum is 23 years of age. He has got what looks like a
Hey,
single stab wound
you well?
to eye. And it does look like there is some bowel protruding, ever so slightly. Do you want to have a look? He was quite lightheaded, quite faint.
Right, if you take a deep breath in, does it feel all right? With no pain when you're breathing in?
A lot of pain.
A lot of pain. Let's have a little quick listen to your chest, to your bellows, see how they're going. And just have a nice radial pulse, 15. Yeah. Quick listen to your chest, okay? Just deep breaths in now, see what's comfortable. We're going to take you to the hospital, all right? Just because you've got that stab wound in your tummy there, okay? We don't know where that's going. So I think we can get access en route with him and give him TXA en route, so I think... Yeah.
When the doctor arrived, his initial assessment was that Callum's injuries were potentially life-threatening, so he took the decision to do all the treatment that he was going to give en route to hospital. So for us, that was time to leave the ambulance. Myself and Chris had done all that we could. Seeing an injury of that magnitude so close to Christmas, you just think that's someone's son, someone's brother. No matter what he said or what he's done, no one deserves to be stabbed and left to die in the middle of the street.
He's going to be all right, darling.
Yeah.
He's going to be fine. I'll get this closed up for you now.
Just a second.
He will, mate, yes.
Right. How'd you get out of here?
Although it looked a bit manic, it was actually really well managed.
It was, actually.
The crew on scene, they were more or less sorting them out.
He's remarkably lucky.
He is very lucky.
That could have been a major hemorrhage, considering where the actual injury was.
I can't stand the snow.
I love snow, man.
Right, I
Snow
hate
is brilliant for so many reasons. Number one, it makes everything look okay.
Even the most gorgeous areas look alright.
You know.
It just covers the litter.
Exactly, it just covers everything, it makes everything look okay. Number two, it makes everything quiet. Scientific fact.
Okay.
And if you notice, when you've got loads of snow, like when it's proper come down, you can't hear the traffic as much.
Okay, alright. Okay.
Number three, snowmen.
Yeah, I'll give you that one.
Yeah, and number four, my dog is hilarious in the snow. Well,
Right, so-
he won't go to the toilet unless you scrape one little patch.
That's hilarious.
Dealing with thousands of calls each day, emergencies come in thick and fast for the West Midlands Ambulance Service.
Good. Malcolm, 71-year-old, suspected broken leg. Fracture or dislocation.
Paramedic Gaz and ambulance technician Lee are nearing the end of a 12-hour shift.
999 activated.
Here we go, here we go.
They've been ambulance partners for 5 years.
Did I tell you I'm going to go look at a kitten tomorrow?
No?
No.
Oh, yeah.
Oh.
I tell you what, though, a good name for a kitten, Willow, just seems to be a really good name for a kitten.
It is actually. That's a lovely name, Willow, isn't it?
Because of the weather, Lee takes extra care along the icy roads.
Oh, yes.
Oh, wow.
And a speedboat on the front. What more do you want? Yep, there's a door open as well. That's the one. Let's go and have a word with Malcolm.
Waiting for them is Matthew, Malcolm's son.
Hello. Yes. I'll walk properly once I get off the ice. Oh.
He's fell out on this step there.
Right.
I think he's dislocated. I don't know, I'm not you now, better. Don't worry about your feet.
Malcolm.
He's just here. No.
Oh, right.
I went down to the bin, got over the step. Right, you're right. Come in.
Right. Let's just have a look. Make sure that we've got a pulse in your leg.
He's moved his toes.
Yeah. We've got a good pulse, which is the main thing. Dislocated your ankle.
We have?
Yeah. Normally wise, it's a fracture dislocation. So you've normally chipped the bone at the same time with an ankle joint.
Right.
Okay? So you will be going to hospital, you will be x-rayed, you will end up in plaster.
With any kind of injury like this, you can't actually see what's inside, so he's definitely going to need an X-ray to find out whether it needs to have surgery or just be cast at hospital.
So what we're going to need to do now, give you some good painkillers.
All right.
When we put down a vacuum splint, it is going to be painful. If we give you the painkillers, it won't be too bad.
How fond of these jeans are you?
Not very, they're his old ones.
So we're going to turn your jeans into shorts, if you don't mind.
All right, you're going to cut them?
Yeah.
Oh dear, new pair of jeans for Christmas and that.
Yeah.
With trouser leg cut, Lee can see the extent of Malcolm's injury.
Well, I'm going to give you some gas and air to breathe before we actually just move that. Yeah. If you hold that, hold it with your hands.
Yeah.
Remember Jack Cousteau, the diver? Yeah, breathe in, suck in, and breathe out through it. Suck in, breathe out. All right. That's it. Just keep doing it like that. Lovely.
Gaz and Lee now need to move Malcolm's badly injured ankle into a vacuum splint.
Right. I'm going to support and lift this leg. OK? Need to come down a bit so we've fully got the foot. Right. Keep sucking. Excellent, well done.
Once the pain relief has had a chance to take effect, the crew can attempt to get him inside the ambulance.
OK. Can you sit up for us? Yeah, you will be. Right.
Got it?
Yeah. Get your end up and out a bit.
Irene, Malcolm's wife of 48 years, will go with him to hospital.
Yeah, my love, come and have a set on there.
You brought your phone? Yeah.
So you were wearing slippers and slipped in the name? Yeah. OK, that'll do, lovely. Let's have a little look at you. Turn your arm over for me. I'm going to see about doing just slipping a little needle into your arm.
What's that going to do?
I can give you some good painkillers. Keep still, sharp scratch. There we go. elevate your arm up, and I play the flute with my fingers. There we go. Just rest that down.
Anything further off me?
No, I'll do a little bit of tapping so that's working before we move off.
I shall jump in the front and await further instruction.
OK. I'd say thank you, Jeeves.
Home, James?
Yes, please.
Through the park?
Yes.
Never thought I'd be doing this tonight.
No. Hopefully not thinking about doing it any particular day. Yeah.
The route to hospital is one Irene knows well.
Oh, well, I work in the shop, the League of Friends shop in the hospital.
Do you?
Yeah.
Might have seen you in there. So we do like that, and we love the soups you do. Oh, the soups are gorgeous. Beef and tomatoes, my favourite.
All right. Probably served you to.
Hey.
I don't recognise your face, so I must have seen you at some time.
Well, there's a lot of us bald blokes about. Bald and slightly chubby. But enough about Lee. OK, Lee. We'll have a bimble whenever you're ready.
Lee takes it slow and steady along the icy roads. And 18 minutes later, they arrive at A&E, where it's hoped Malcolm can be fixed up and returned home in time for Christmas.
Right. If you step off first, Lee will just point you in the general direction where you need to go.
There.
He's useful, isn't he?
Cheers.
Yeah. He got sacked as a concierge, you can tell. Right, that's it. Keep your hands on your lap so we don't scratch your knuckles on the way out. Tell you what, one of the easiest diagnosis of jobs I've ever done.
Yeah. Bossed.
Yes, the angle that was at.
Yeah. That ankle is bossed.
Yeah. Oh, midnight, that's it.
Woohoo!
Woohoo!
Dorothy had broken her wrist when she fell, but luckily didn't have neck or spinal damage. She was kept in hospital overnight, but allowed home the next day. 8-day-old baby Freddie's apparent jaundice sorted itself out. And Freddie was fit and well enough to enjoy his first Christmas. 29-year-old Leanne, who had multiple seizures, didn't have another one before reaching A&E. She was referred to a specialist for more in-depth investigations into their cause. 23-year-old Callum, who was stabbed, did have internal bleeding and needed surgery. He was kept in hospital for several nights before being allowed home. His baby daughter arrived just in time for Christmas. Malcolm, who slipped in the snow, had fractured his ankle. He had an operation to reset it, followed by 4 days in hospital and 6 weeks in plaster. He's since made a full recovery.
It was quite nice to be driving back thinking, all you suckers are going to work.
Oh, that is the best feeling when you're like turning the key in the door. Everyone's going to work and you're like, I can feel my bed.
Next time.
We just want to have a little look at you. Don't be upset.
The paramedics are on call in the busy run-up to Christmas.
Is he fully awake now?
Not really.
Joseph!
And with the festive season come new challenges.
Wake up for me, Carl. Come on, Carl, wake up for me.
And new and exclusive Inside the Ambulance at Christmas continues tomorrow night at 8. Here next, though, we've sex knives and liposuction.